Every major shift in public health begins with one breakthrough. Among the voices shaping our understanding of plastics in the human body, Dr. Heather Leslie stands out for her clarity and her scientific leadership. For over 25 years, she has made the invisible visible, tracking plastics and chemical pollution across ecosystems and uncovering how deeply it enters our lives. Today, through Heather Leslie projects, she brings cutting-edge science into real-world policy and industry decisions. From beaches and seafood to the human bloodstream, her research has transformed how the world sees pollution. In this episode of Health Commune, Dr. Leslie breaks down why microplastics are now a public health crisis and what urgently needs to change. Good evening, Dr. Heather, and thank you so much for at least 1 hour of your time. I can understand how valuable it is. You're doing so much of great work in microplastic and overall in plastic. And I was going through your research, there is something regarding the domestic waste water, drinking water. There was a study that you have done it in animal related microplastic in their blood and then human as well. And I think you are the best person to help us out to understand more about microplastic. Our topic of discussion is microplastic in blood. We are working on a documentary and we are talking to experts in the overall in the world and trying to get the information with them. That will be in a podcast format. So thank you so much for your time today.
My pleasure.
At what time in your career you got specifically into microplastic and nanoplastic related research, or you were involved into it from the beginning?
Okay. My career really started with an interest in environmental pollution. And I learned how to measure environmental pollution, making the invisible visible. And in my PhD, I worked on how chemicals interact with plastic, how they absorb to it. And so the next logical step was to look at microplastics, because I was looking for what's going to be the next big emerging contaminant. And it turned out that it was a good guess, because microplastics and nanoplastics did turn out to be a type of contaminant that has really captured the world's attention at the moment.
Okay. Currently, you're working in the academic environment. You're a professor and you also have your own organization. So what exactly you do nowadays?
Okay. So I made a big jump a couple of years ago, because I left the university after a couple of decades of being there, because I really wanted to sort of amplify my message to a wider audience. And I love teaching and I love doing work in the lab, but there's a lot of research that I can do outside of the lab. And so I'm busy with a big experiment in my own career right at the moment.
Okay. Before we get into the human exposure, if you can tell us what were your findings in the other studies that you have done before the blood-related studies?
Mm-hmm. So here in Europe, a lot of the research started out in the sea. Before we got to the inner sea of our bloodstream, we were looking on the beaches where you can find microplastics and also plastic litter, so marine litter or marine debris washed up on the beach. It's a very visual type of pollution. So it really captures people's imaginations. And you don't even have to imagine very much, because you can just go out on any beach and usually find something that shouldn't be there, some piece of debris. So we started looking, for example, in filter feeders like mussels and oysters, which also have a connection to the human consumption food chain. And also in the water column, we developed a method to take water through a sieve and know exactly how much volume we were taking through, because you have to take through a lot of volume, and then figure out how many microplastics per liter are in the seawater. And we could do that on lakes. And we looked in sewage treatment plants, on land, at sea. Basically, any place that we could look for microplastics, we were looking for them. And I and my colleagues it's usual that we find them, because microplastics are so ubiquitous. They've been found even far away from where human beings are living, because they can travel, they can fly on the wind, and they travel through currents. So we can find them at the sea bottom. And when you're looking at this, you're also interested in where's it coming from? And unfortunately, little microplastics in the bottom of the sea don't have passports, and they don't tell you where they came from. So you have to think about what are possible sources, because every time we make a report, everyone wants to know what can we do about it, which is a question I like, because I like it when people want to do something about pollution that we're finding. But sometimes, they could be paint chips, they could be pieces of fishing nets, they could be something to do with gas and oil industry, or they could just be from recreation.
Yeah. When we talk about ocean, there is one study in India which they were able to see it at a coastal areas in we have a very large coastal area in India, and the study is already published. How's the contamination, or we call the exposure over there? Like, is it really bad? Is it something that we really need to worry, or is something that it's there and it's growing? Is there any change that you are observing in that?
So there's a lot of monitoring going on, and monitoring doesn't really solve the problem directly, but it does give you information about where you stand and if some of your mitigation measures are having any effect. And in Europe, there's a lot of plastic pollution, and it's visible, and it's not just on the beach, it's also in the forests and in the cities and in the canals here in Amsterdam. But I wouldn't say it's a special hotspot compared to other areas of the world. I really think, we're all in this together, and where more of us live and create a lot of plastic litter, there'll be more plastic litter, and when there's not very many people living somewhere and not very much industry, there'll be less plastic litter close by. So we have the problem here as well, but it's also a problem in India and Asia and North America and South America and Africa. So it's a global problem, and some people have estimated where hotspots are in large population centers. It's just assumed that there are more sources of plastic litter, and also where waste management is not as sophisticated. Then you might have higher amounts of plastic litter building up. So it just depends on the local situation, local conditions, how many people live there, how good is the waste management, and some other smaller, less important factors. But I think population and waste management practices are pretty indicative of how much pollution you'll have.
True. And, I can understand India is a very populated country. We are a very densely populated country. And when I went to one place where I stay, and we were looking at a river and where the contamination and all the plastic is coming from and how it's going to the river, and all that we have covered as well. And for me, it is understandable if it is India. Our waste management system is not so active. Segregation is something that started 5 years back, especially in the metro cities, in the societies where we stay. Plastic and food, all that segregation thing that helps actually for recycling. Is there any other source where it is happening? Is it like a direct, the sheer amount of plastic that is available in our day-to-day life? Is that a problem, or it's waste management is equally contributing to it?
Waste management, even if you have the best waste management in the world, there's always going to be leaks from the system. The wind is your enemy. Sometimes, I can see here on the streets of Amsterdam that somebody even put their garbage out to be collected by a garbage truck. But in the meantime, the wind is blowing a lot of styrofoam around. And, there's a problem with pellet loss. So every thermoplastics start as small nurdles or pellets of plastics that get melted into a new product. And those get transported around the world. And there's along train tracks or in harbors, sometimes there's gigantic amounts of these pellets that just get lost. They fall off the train. During transfer, there's always some loss. And so there's just a multitude of ways that plastic finds its way, even if you're doing your best to keep it contained. There's always some ways. And of course, we can lose our plastic. If you drop a plastic bag on a windy day, I've done it too. I had a plastic bag on my bike seat, and I was taking a ferry, and the wind came and blew the plastic bag away before I could catch it. And accidental losses are also possible, and that happens to everybody
True.
every year at least, even if you're trying not
Yeah.
to release any. So I think
Yes.
it's really hard to really make sure there's no leakages from the system at all. But
True. Yes, leak. Even if the system is there, leak in the system will be possible in any country,
yeah,
right? No matter how robust the system is.
and also awareness is really important because especially
Mm.
teens, somebody feeling rebellious would like to throw their garbage on the ground. So even with awareness, sometimes you have some behaviors which are still leading to plastic litter on our streets and waterways.
Okay. Your team and you were the first, actually, very initial days you were publishing about microplastic in human blood. And the data is already published in scientific journal. I think way back in 2022 or before that you started speaking about it. What were your findings that point of time?
When we wanted to look at human blood, we were a little concerned that we wouldn't be able to have a powerful enough at detection limits.
Hmm.
That we were concerned that it would be easier to find bigger chunks in the sea than there
Yeah.
would be to find the very tiny chunks that we expected to find in the bloodstream. So we had to first
Mhm.
develop a method, and that took us the longest time
Okay.
to first be able to, first of all, not measure anything so that we know
Hmm.
that we don't have background contamination in our process. And
Hmm.
secondly, we wanted to look at very, very small fractions of particles.
Hmm.
So that
Hmm.
meant that we had to step from using laser-based techniques like FTIR and Raman, which is named for an Indian researcher, by the way.
Mhm.
So these techniques, they are good at identifying particles that are a little bit larger than we expected to find in the human body. So we developed a technique which is called pyrolysis, GCMS, and
Mhm.
it doesn't count the particles; it measures the mass of particles of the same sort. And
Okay.
so we had to target some major polymers, and we
Mhm.
targeted some of the biggest, highest production volume polymers. So we
Mhm.
targeted in our study high production volume polymers such as polystyrene, PVC, polyethylene,
Yeah.
polypropylene, PMMA also. PMMA
Mhm.
is a type of polymer that's often used in the human body. So sometimes in dental work, etc. So we thought,
Okay.
let's pick that too, even though it's not as high production volume. What we ended up finding was that our method was strong enough to be able to detect plastic in the bloodstream, and
Mhm.
we found four polymers in humans, and we were able to quantify them as well. And that meant
Mhm.
that we could be rather sure of our quality control, because we really thought
Mhm.
that was very important. You're not going to publish this kind of news if you haven't checked everything 5 times
Mhm.
to make sure
Yeah.
you've done
Yes.
every check and balance that you could possibly do
Mhm.
at that time. So
Mhm.
in the end, if you count up all the different types of polymers that we found, on
Mhm.
average, there could be around 1.5 micrograms in every uh, milliliter of human blood in the
Mhm.
small sample size that we had. We had only 22 donors. It is a proof of principle that
Mhm.
plastic can be detected inside the human body in the bloodstream.
Mhm.
In order for the plastic to enter the bloodstream, they have to be absorbed. They have to cross
Mhm.
epithelial membranes, and that means they have
Yeah.
to be small.
Yeah.
At least that's what we thought at the time. And so we knew we had to have a method that was sensitive enough to really see the tiniest size fractions of micro and
Mhm.
nanoplastics. So
Yeah.
that's what took many years of development in order to be able
Mhm.
to do that. And since
Mhm.
then, several other articles have come out using our technique, but also other techniques. And they also have found microplastics in the bloodstream. Even
Yeah.
some studies have found larger particles than I had originally expected could be found in the
Mhm.
bloodstream.
Okay. This method that you have identified, is it like commercialized? Are people using this? Like, is it been shared with the labs
Yeah.
for medical colleges or doctors to actually send the samples patients?
Well, the method that we used in 2022, it's all published, and it's free online to download. And other articles since then have also been published, and so the methodologies are easy to find, but they are sort of, I would say, in the early stages of technical development, and it's still very, very difficult to do this work. It's not really at the stage of technical readiness that commercial labs can take it on board and really measure, because the research is still ongoing and the analytical development is still ongoing. So I think we have to wait a little longer before we can have people sending in their blood samples, and have a commercial lab doing this work.
Got it. And these 22 people, those who those who volunteered to participate into this study, they were like a healthy people, or they were from the patient? They were healthy people.
They were healthy people, yes.
And did you study anything regarding their habits, or where actually was the source? Anything you were able to get data from that side, like when?
We had healthy volunteers, but we didn't collect any other information about them. The focus of the study was really to develop the method so that we could look at different people. And then we tried it out on 22 people, you could say. And we did prove that the method could detect microplastics in the human bloodstream. But that was more like a pilot project. And once you get a pilot project done, then that opens the field to larger studies. But this was, we always have to start with a baby step. And I'm confident that there's so much interest in this topic that we'll see more and more, larger scale studies coming down the pipeline.
In your research, you also talked about there are some chemicals that are associated with the microplastic. Is this all the chemicals that we talked about, or anything additional that you were able to identify in your research?
I started out looking at plastic additives. So the flame retardants, I did a lot of work on those. I measured those in human blood, even in European parliamentarians before they had to debate some chemical policy in the parliament in Brussels. So it's my specialty was more on the flame retardants, and I've measured quite a lot of those. However, there's a group that has collated all kinds of research on plastic additives. So the thousands and thousands of studies that have been done to date. And they came up with a number close to 4,000 additives that are known to be used and applied in plastics today that are known to be substances of concern for their toxic effects. So there are thousands of chemicals out there that are being applied in our day-to-day plastics sometimes that are leaching out and also helping microplastics cause toxicity. So when a microplastic enters your body, it's not just a polymer chain. It comes with a sauce, with a chemical sauce always. And these chemicals will come in with a particle. They're loaded on to the particle. They're inside and on the outside. And they can be released into your tissues once they're in your body. And the interesting thing about the combination of chemicals and microplastics is that these particles can cross the blood-brain barrier. And this way, chemicals that ordinarily couldn't have crossed the blood-brain barrier can piggyback on these particles. Interestingly, you can use that in nanomedicine. I don't know if you're familiar with that, but there is a field of drug delivery science that looks at polymeric particles as nanocarriers of pharmaceutical chemicals, medicines and drugs. And so there's one area of science that's looking at how can we put drugs onto microplastics so we can get it into people's brains. And there's another area of science that's looking at what's the downside of that, of having plastic particles in people's brains. And yeah.
When I started working on this, I was thinking that, yes, it's there in my body. Probably it's living like a microbe or parasites. Probably it's not damaging. But then now there is a correlation with Alzheimer's, infertility, and researchers are still working on it. It's at a very, very initial stage. In your experience, are you able to see that, okay, we know that it crosses the blood-brain barrier? I was reading there are some publication, it also crosses the ovarian barrier, this placental barrier able to go to the fetus, testicular barrier, and that's also causing infertility in men. Any such finding from people you interact with, or any research that you are aware about, that will also help to talk about how massive is this problem, and why we should focus on it now.
Yeah. So one of the reasons why I was so interested in finding out if there's microplastics in us is the knowledge that particles can cause oxidative stress and cell damage. And when oxidative stress starts up, we can get inflammation. And if that inflammation doesn't go away and it becomes chronic, that opens the whole field up to many different possibilities for chronic disease. I was interested to read in the medical literature that for neuropsychiatric diseases like Alzheimer's and some other Parkinson's, dementia, these can start. There is a hypothesis that these start with an inflammation in the brain. And I thought if my microplastics that I'm measuring in our blood and that are being transported to all of our organs and tissues of our body through our blood, are these causing inflammations in those organs and tissues? And if so, could that be a prelude to some chronic diseases?
Okay.
So that was it seems to me that we can't ignore the possibility that these particles are causing cell damage and oxidative stress and inflammation. And these are things which we should be avoiding in our bodies instead of adding more fuel to the fire and having our bodies have to repair so much damage.
When we talk about normal stress, it's everything is not in our control, like life situation, stress that is happening, work, travel, all these things. And it's very difficult to control. But when we talk about the stress that has been, or any kind of a reaction that is causing because of something, as something that we can actually avoid in our day-to-day life, right? Like we can actually prevent, and it's absolutely preventable. It's not necessary. It's very difficult, I know that, but still it is there, and it's causing that oxidative stress, right? Like it's something that we are actually inviting it to ourselves and allowing that damage to happen. One question I want to ask is, I'm a medical professional. I know other doctors, and I know that doctors are still not talking about it much. Okay. And I have a good network of doctors community, and they'll agree with me. We are not speaking about it yet. We will, for sure. Is there a big knowledge gap that you see? Like you are from a research and lab and publication, and you are also now creating awareness through all the consulting work you are doing, as well as the talks that you give based on that. Do you see a big knowledge gap, and what's that missing link between what you know and what probably the people should know they are not aware?
Well, there certainly are still knowledge gaps in the research. For example, what's really relevant for doctors is the epidemiology. We don't have epidemiology of nanoplastics. We're just really starting to understand what the health impacts are of micro and nanoplastics on humans. So I think, in the beginning, when I was speaking to doctors, they all assured me that this was not a problem, but they hadn't looked into it yet. And then after one conversation with me, if I came across them again in 2 months, they had a different tune. So it has to do with awareness, and some of the things, the reason why doctors are not aware of it is that there's no medical research funding sometimes. I worked with doctors on several projects, several proposals. I worked with doctors on several proposals to try to get a little research funding to work together. But the medical community wasn't interested. I think we were a little bit before our time, because it didn't have some clinical application yet. And if it doesn't have a clinical application, sometimes it's harder to get some research funding for that. I think at this point, there is, what can you do as a doctor, knowing, even if you have read all of the literature and are up to date on all the most recent findings, you're still in the same place as the rest of us who don't really know exactly what to advise a patient about their risk of developing diseases, because this is simply not quantified until you have large studies with big populations that you follow in time, and you gather a lot of information about them, about their health status, and take a lot of samples and follow it all, then you start to build the weight of evidence for this being toxic. Right now, we are talking about toxicity testing in cell lines. So we're zooming in on a small biochemical pathway, and we can see, oh, something is changing in the lipid metabolism. We can see, oh, there's a change in the microbiome when people are eating microplastics. And different microplastics in mouse studies make different changes in your microbiome. And the microbiome, I've learned from the medical community, is really important for health. So there's so many unknowns, and it feels uncomfortable not to know yet. But it's interesting to think about the precautionary principle, and that when we have so many signals that at certain levels toxicity can appear, especially inflammation, especially what we've learned from air pollution studies, that air pollution is quite epidemiologically well studied and linked to cardiovascular disease and various other respiratory diseases. So we're not there yet with micro and nanoplastics, like air pollution studies is. But doctors can already advise patients to reduce the amount of intake they have of micro and nanoplastics. So rethink our relationship with plastic, because I think these bodies of ours are magnificent things. They work 24 hours a day for us, repairing damage, building up new tissues. And really, it's kind of a thankless job sometimes, because we don't show them enough love, some of us. But it is really important to consider the job that our immune system has to do to take care of everything that we're breathing in and swallowing every day. It could be that if we have a lower toxic load that we're exposing our bodies to, that our bodies are not working around the clock, cleaning up the mess. And if our immune system is less stressed, we can deal with the bits and pieces that are coming in despite of all of our best efforts. But if we really go overboard and don't pay attention to it at all, then we might be overstressing our bodies. And what I've noticed in this research with the chemicals and the microplastics, people are not interested in it, especially until they get sick themselves, or they learn that there's a factory in their backyard that's been emitting this stuff for a long time. And maybe they work there, and maybe they also have some health issues. And that's when they start to pay attention to environmental factors and health. And see how can I change my diet? How can I change my lifestyle in order to try to regain my health? But if you're listening to this and you're already healthy, you can do a lot of preventative work right now to protect your body, to respect it, to use products that respect your body and respect your health, and that are designed to not pollute your body, but to nourish it and to be kind to it.
Currently, I am working on probably a research. I should be able to get funds to do that research to find microplastic in blood in Indian community. The studies that we are working on, one protocol that is there where we are looking at probably patient population like pregnant mothers or patients with stroke and other things. Whereas I am personally interested, because there is no data, why not to find out what you have done, right? Healthy human volunteers, and study their habits and then see what's contamination. So I want to go phase 0 before I go phase 1 or phase 2 kind of a mindset. But if we talk about lab related thing, where you talked about that at a cellular level, some research is happening. So where the research is going? Your research was to identify whether the microplastic and nanoplastic is there in blood or not. What the researchers are trying to find out now in this space?
So in toxicology, to determine the risk, you need on one hand to know what the exposure is, and on the other hand, you need to know what the hazard is. And so how bad is it if this level of contaminant is in our bodies? And so these two groups work quite closely. I feel like I'm sort of a hybrid between both of these groups because I'm really, I was trained as an ecotoxicologist and also analytical chemistry. So these two really come together well, because we need to know what's inside of us. And there's a lot of papers that came out just in the last couple of years about where can we find all of these particles, and how much is in there, and where are they coming from? Even in the medical community, there's a lot of research about injectables, how during an operation you can be exposed to plastic directly through infusions, through medicines, through injections of all sorts. You can be exposed to nanoparticles of plastic. And so there's a lot of work being done on the exposure side. And now everybody seems to want to know if they can find it in their field of interest, if they're working on kidneys or reproductive organs or the fetal environment. And so there's just an explosion in interest in that. And at the same time, to know what that means, we have to look at what kind of mechanisms of toxicity are associated with these things that we're finding in our bodies. And so there's in vitro studies. So that's a laboratory test where you usually have a cell line, and it's you have a protocol to test for various oxidative stress or lipid metabolism or something with energy. There's all these different endocrine disruption. There's many different in vitro toxicity tests that you can let loose on micro and nanoplastics. But that only looks at a molecular level or a cellular level, but you can also look at organ level, like organ on a chip or models for organs, and see if you can figure out what kind of specific mechanisms for the heart or for the liver or for the brain there might be. And then there's the big, huge step that goes to patients, and to look at large populations of patients and follow their exposures and the development of the disease. We can also look at occupational health. So in toxicology, we often look at who is the most exposed. Somebody working in a factory, somebody recently in Norway. I was in the beginning part of a study that looked at playing on soccer fields that are indoors, that have a lot of crumbs of tires on the surface of the soccer field, and a lot of exposure comes through playing sports on plastic. And so you could look at typical scenarios where in the real world people are exposed more highly to these particles. Another example is in traffic. If you live near a road with a lot of traffic near a big highway, or if you're cycling along a big highway with a lot of traffic, you're also breathing in these particles. Or if you work in a textile factory, there's a lot of fibers around. If it's polyester, then you could be breathing in polyester or nylon particles. Also cotton, you can also breathe in those particles too. And depending on the chemicals that are coming in, like a Trojan horse, and interacting with your lung cells, you can have different types of toxicities, different types of occupational health hazards. Those are also being studied. And so I think the next big step would be to go to big populations and look at special populations who are vulnerable, who are occupationally exposed. The fetal environment is also very important environment, most important environment for the next generation.
True. I think I was reading somewhere in your publications about the cosmetics. Any findings that you have done, any research in the cosmetic industry, and they are the plastic containers, even the products that are there are also very chemically heavy. So any kind of findings you were able to find?
One of the good things about the research that we did on cosmetics was that in Europe, we have new legislation against putting intentionally added microplastics into cosmetics. There are lots of exceptions, and there's a lot of problems with how everybody looks at the definition of what a microplastic is. But there has been some progress on that front, because sometimes a company will voluntarily remove some of the dangerous ingredients on their own without even a legislation having to come into force. But of course, they only do that if they really see a financial benefit as well. Just recently, I was checking in with what we know about. What I can say is exposure to microplastics for humans is either via breathing it in, or drinking it, or eating it. But until very recently, we didn't really think very much about dermal uptake, because nanoparticles don't really go right through your epidermis. They can get stuck there. They can get stuck in a hair follicle, and they can cause inflammation there. But they don't cause systemic effects. At least that's what we were considering, because they don't really go into your bloodstream if they're just applied on the skin. So for a long time, it was considered safe to put a microplastic on your skin. But what I'm learning is that a lot of microplastics are injected into the skin. And also, when you have a wound on your skin, or if your skin is inflamed, it's more permeable. So you could also have real absorption of micro and nanoplastics via the skin in certain cases, which is another reason to switch to natural personal care products.
True. And you are saying that you are involved into policy making, you influence the policy, you're part of the policy. What kind of a work? Because that's where I am thinking that, fine, I'm creating awareness. People are going to ask me two things. One is what next? And second is how, if I have microplastic in my body, how to actually get rid of it. Currently, I do not have answer for both the questions. I am interested in doing study in India and probably submitting it to the initiatives that I am aware of. There are people, those who have good philanthropic initiative and they care about such causes, and probably will be able to submit some reports over there. How you are taking all this knowledge, and you have so much of knowledge about it, but what you are doing, like, are you influencing the policies? Are you telling them to do some regulatory changes? How you are involved into that steps?
All of my career has been about finding information that other people didn't have yet and telling them about it. And then you do get invited to certain tables. And I have gone to speak for politicians and policymakers and also industry people on many different occasions. So it does feel like it's agenda-setting research. When you measure something that hasn't been measured before, and you talk about it, it does get noticed, and people are interested. Sometimes not powerful enough. Even governments aren't powerful enough to regulate this, because there's been many attempts to regulate it. We haven't gotten very far with it. A little bit of work has been done in Europe on the microplastics in cosmetics and intentionally added microplastics, also in paints and things like this. But we really have a long way to go. And I sometimes wonder if our vintage organizations like the WHO is even able to do anything about this. Like the UN has tried to make a plastics treaty, but the rule was to have consensus of all the countries of the planet. And I think that's not going to fly for a long time, because we agree on a lot of things in this world, but not on everything all of the time. So this is such a complex thing. And so I think we really have to bring it down to the local level and see what we could do there. Because this is on the local level, things are also, we are enabling this pollution system we're feeding it. We're not doing anything but feeding it. And then in that case, you'll just see it grow. But there's a room for top down, and I'm waiting for that to happen. But in the meantime, there's also a lot of energy in our society, a lot of people who are interested in this topic and who want to do something. And I encourage everybody to do whatever they feel is needed. And the things that are successful are going to be noticed, and we'll scale those things up. And so I think it's important to keep the communication lines open with policymakers and speak your truth to the power. But also at the same time, think of what I can do in my own life, because if we're not doing it in our own lives, there's no way we can expect organizations like the UN to do anything. So we have to take responsibility ourselves for these things and not just outsource all of our power to authorities. So I'm very strong on this, and I think it's a fun way to deal with this topic, which is, one of the things that's really bad for your immune system is to worry and to panic and to be afraid. And so we can turn that switch off and turn on the switch of having fun, living more in alignment with what we want and what we actually really need. And the more you make choices in your day-to-day life that is in an alignment with what you really want, the happier you'll become. There probably won't be microplastics running through your veins as much if you're really aligned with the way you want to live. And that means making different choices in your day-to-day. And it doesn't mean a revolution. And it doesn't mean throwing out your favorite product and being all sad about that. No, it starts with something you didn't want in the first place, and something of higher quality, not impoverishment. For example, what about the coffees and teas to go that you buy in a disposable cup with polyethylene lining? The tea bag that goes in is made of plastic, and it releases 100,000 nanoplastics into your cup of tea. And people think that that's
healthy.
Yeah, they think it's wealth.
Green tea is healthy.
They think it's good, and they think it's cool, and there might be a cool logo on the on the cup. But what is it really? It's a total impoverishment of our health, because we know, and certainly everyone in India knows how to set a good cup of tea using tea leaves. You don't need a plastic bag to put your tea leaves in. We don't. You drink it out of a beautifully designed cup that doesn't release plastic, that has a nice sip, and self-care, because it might take a little bit longer to make that tea than the tea in a plastic tea bag that somebody else made to go, and these are the things that, are completely actionable, and it'll save you every day several hundreds of thousands of nanoplastics that are going through your body. And it's also fun, because people will say, oh, when I come over to your house, I always get a great cup of tea, not the plastic tea bag,
true.
tea. And you might discover different types of tea when you don't just buy the ones that are pre-packaged,
Yes.
And another thing I'd like to say about our exposure, there was an interesting study just that came out this summer. This study showed in mice that microplastics, and also very small nanoplastics, so the tiniest ones we can imagine, they were labeled with metals, and they could be traced as they went through the whole body. They were fed to these mice, and a very large amount, the majority of them, even the very small particles, which I consider absorbable across the gut epithelial layer, they went right through the mouse and were excreted as feces. And and that was really good news to me, because I thought, those small nanoplastics would probably be absorbed and go into our bloodstream. But the good news was a lot of them don't. Some of them do, and a lot of them don't. So not everything you swallow is going to be ending up into your bloodstream and in your organs, but it will end up in your microbiome. And it could have an effect there, but hopefully it'll be eliminated quickly.
Yes.
But I think the less problems we create for our microbiome and for our macrophages, our immune system cells, and for our organs, the better.
You've already given me the takeaways, right? Like what things. I love the way you explain the whole tea things. I'm a tea lover, but we are like a proper normal tea we prepare. There is no tea bags and anything. We prepare the tea, Indian tea. I have a last question before I close this whole conversation. Is if you have to do a new study in 2025, what kind of a research you will do now? If you have like unlimited funds, somebody is coming and saying that, okay, you don't have to worry about the research grant and anything. Let's do a study. What kind of that ideal study you will do based on all your knowledge that you have?
Yeah. Well, I might have a couple of answers for that. Of course, to date, we're just doing low numbers of samples because they're very expensive to do even just one sample. So it would be really nice to have no limits to the sample sizes that we can measure and look in one person at different time points, and also in many different people at the same time, and learn a lot about their health status and their occupational exposure, and link that to where is it all coming from, so that we can find ways of turning off those taps so that it's not coming anymore. And one thing that I think is quite revolutionary, and I don't think it's happening very much in the medical community at all, is to study what makes people healthy. We've made lots of inroads in what makes people sick, but I would also include a part of the study to look at people who are already healthy, who have very low microplastic exposures. How do they do it? And I think I would also want to measure how much fun they're having doing it, because I think they've already made some decisions for themselves. They haven't just accepted and consented to having a polluted body that is inflamed and possibly also very painful and not functioning in the way it should be functioning. All of our bodies should be functioning perfectly. We are born to be healthy, not to be sick, and our bodies know how to heal themselves. We encourage them to heal, and doctors help us heal, but our bodies are really doing most of the work, and we should just get out of the way, not give them too much poisons, and let them do what they need to do to keep us going. And so I think it would be very interesting to do a study on what makes people healthy. And let's see what we can learn from people who are living a healthy lifestyle, and we can make our own decisions to become more like them.
Yeah. At least there should be some protocol. We have the protocols for how not to have hypertension. We are very disease specific people, right? Especially the medical community, how not to have hypertension. And if you have the hypertension, what to do for preventing other complications. We are very, very focused. But I agree. Is there any study that find out what makes us healthy? Not about only the diseases. Beautiful. I have seen your website, and I'll be linking the website to our description section and when we are promoting. Now you are working in a very, not in an academic environment now. So what kind of work you are doing, how you are associated with the projects? If somebody who's listening to our podcast or through the documentary, if they want to reach out to you, what kind of projects you involve yourself with, and how you help people with your expertise?
Yeah. So I'm an independent scientist. I still do research. I also help clients who are trying to implement things based on the research that we're doing. So I'm still working on nanoplastics and microplastics and the chemicals that are associated with them. And so I would welcome any collaborations with India. I've had Indian colleagues before, and I would be more than happy to work with you again. And if I can help you, Dr. Smita, with your work, we should stay in touch about that.
Definitely.
When I work for the public and private sectors, I've always done that. Also from the university positions that I've held, we've always done contract research for the government, for research foundations, for the UN, for the EU, and also for industry, which also wanted to find out how bad their products are performing or how good they are. And so it could really be anything. I've worked for even financial institutions who need advice when they're investing. They want to know if this is a polluting industry or if it's a healthy industry to invest in. And also European research, I'm still involved, and I'm still publishing in the academic literature with my colleagues, but just not with a flag of the university, just with my own flag.
Okay. Okay. I know, how do you manage to do so many things? It's been years that you are working, and the amount of knowledge that you carry. I love what kind of a research you want to do. I'm doing a very, very simple work right now, building awareness, trying to get into a project where I'll be able to publish something. But I want to probably go a little phasic, looking at like healthy human volunteers, then probably working with the hospitals, depending on again the funds and thing that are available. But let's see how it goes. One thing I'm doing is to changing my own life. Okay, so we just celebrated Diwali, and Diwali is a Christmas for Indians. And what I did is like a Diwali cleaning that we do. I tried removing complete plastic from my home as much as possible. So when I was cleaning, I was like, how to do plastic free home? It was not possible for sure, but I managed to do as much as I could. And then I said that, okay, now everything is done. Let me go and buy some grocery and then organize my kitchen because Diwali we should be ready. And then I saw that everything that I purchased was a packaged in plastic. I was like, it's impossible to get rid of it now because every packaged material was a plastic material. And it's and that time I realized that, oh, I should continue doing what I'm doing. It's a long journey. I should be ready for that. And I'll be very happy if I get some help from you. Thank you for taking out time to come on our podcast.
Oh, it was my pleasure, really my pleasure. And I hope we'll do something together in the future because I
Yes.
felt like it was a really good connection with you.
Yes.